my research topic, and if I may have the slide shared with our participants, that would be absolutely great, is about corruption, and more precisely about petty corruption. To be more precise, focus on the healthcare sector in the public domain. And my research project is a research project which focuses on one concrete initiative in one concrete institution, an outpatient clinic in the city of Vilnius, which is the capital of Lithuania, and where I have spent quite a number of years in working on anti-corruption. And that initiative took a couple of years ago. And so the presentation, the format of the presentation will also be threefold. I will, first of all, of course, introduce the context we've been operating in, speak a bit about corruption, in Lithuania. We'll then focus on the initiative that took place in the outpatient clinic in Vilnius. And then I would very much like to bridge that with the month that I will spend here, offering you some theoretical frameworks, and of course, inviting you kindly to ask questions and comment on what it is that I will have presented by then. So without any further ado, of course, when it comes to corruption, the reason why it matters is quite straightforward. We can define corruption for the purposes of our conversation as the abuse of publicly entrusted power for private gain. And as we all know, it is quite a widespread phenomenon. It's a problem that many people face in their daily lives. Corruption kills, corruption makes life more difficult. And the challenging part in the conversation about corruption is that having spent tackling this issue for the past 20 or 30 years, we haven't actually got very far. If we look, for instance, at the data provided by the Corruption Perceptions Index by my fellow colleagues at Transparency International, because the world, according to that particular index, we can discuss the methodology perhaps in some other format, is stuck at the score of 43 out of 100. And that is the feeling and the experience that many of us have been sensing over the past 5 to 10 years, with new institutions having popped up all around the world, many anti-corruption agencies taking on the anti-corruption agenda, new laws having been passed in various countries, ranging from new EU member states to other emerging and older democracies. Yet the challenge of corruption hasn't gone away, and bribery is one of the forms of corruption that many of us still have to experience when it comes to our daily lives. Of course, there are glimmers of hope, and I would very much like to think that Lithuania could be one of such examples. Some of us would say that Lithuania is a poster child of anti-corruption success. If you look at the corruption perceptions scores, with the score and the position of the country steadily improving over the last decade, and Lithuania being one of out of half a dozen of countries that have steadily improved when it comes to this particular metric. Of course, we have some other research to back that up. One of them is the Lithuanian Map of Corruption, a representative quantitative survey, which now is conducted every single year, and which measures both the perception of corruption and the experience with corruption when it comes to presidents, business people, and public servants in the country. However, if you were to take a closer look at this last graph, you would also see that in the last couple of years, the scores, reported scores, haven't really budged. And 1 out of 10 people in the country still would tell you that they have given a bribe over the past 12 months. The question is why? And perhaps the reason or the answer to that question lies in the fact that when it comes to corruption in the healthcare sector, it still remains a huge concern. In particular, bribery remains a huge problem. As you would see, 1 out of 5 residents in Lithuania would tell you that they still were asked and often would have given a bribe over the span of the last 5 years. And more so, And my presentation seems to be stuck. So if you were so kind as to move the mouse. Meanwhile, I'll continue. The readiness to give bribes is still quite prevalent. You would see that 2/3 of Lithuanians believe that bribes actually can help solve problems, and more than half of Lithuanians would give a bribe if asked, if a situation, an opportunity, not an opportunity, but a situation would require to do so. That, of course, is not helped by the fact that a lot of anti-corruption efforts that we have in a country like ours have largely remained on paper. Indeed, we have a lot of investigations, and we have people going to jail for corruption. However, when it comes to the sense of ownership from public institutions, the private sector, you would see that a lot of anti-corruption commitments actually are box-ticking exercises. For instance, the last anti-corruption plan we had in Lithuania contained a lot of different provisions and obligations, yet more than half of them were basically amendments to different guidelines, laws, and trainings. Very little emphasis on real normative change or behavioral, sustainable behavioral change. Of course, there are good examples of practitioners and representatives of, say, the healthcare sector approaching this issue bottom-up. For instance, for a number of years now, we have had a wonderful initiative in various hospitals and outpatient clinics in Lithuania with the medical professionals basically saying one very simple thing, and that is that the best way to thank them is to smile. They would have those stickers put on the doors, patients would see them, that would stir discussions. We would have other initiatives like reading out the Hippocratic Oath, because, for instance, some medical practitioners, young doctors, discovered that the Hippocratic Oath actually contains a very clear stance against corruption. So they would go out into the hallways of their hospitals and clinics, and once per year would read that out and then would keep the Hippocratic Oath in various places that are publicly accessible and would be seen by the patients. That is why we at Transparency International Lithuania, because the initiative that I will present to you briefly actually happened while I was at the helm of Transparency International Lithuanian chapter, drew a lot of inspiration from. We knew that these initiatives take place. They looked wonderful, and intuitively, we saw that they might actually bring some change about. However, what we were really interested in is to have a deep dive and actually go to one particular institution and perhaps convince somebody in the administration to turn the institution into a so-called anti-corruption lab, seeing whether we can actually create a behavioral change with various kinds of interventions, spending more time in one particular place. And that dream actually came true in 2015 when the colleagues at the Lazdina Outpatient Clinic, a relatively small medical establishment in Vilnius, agreed to take us in and develop an anti-corruption format, an anti-corruption initiative together. Of course, we were very much interested whether that could contribute to the changes in corruption, bribery levels in Lithuania, not in Lithuania, in that particular clinic, and perhaps show the way that can be done in Lithuania, broadly speaking. But we also knew that this is the first time that we had a chance to speak with medical professionals and nurses, patients, the administration. So we also wanted to understand whether it in any way had any effect on the way patients understood the quality of service, whether they thought bribery was part of the deal or actually that was a hindrance. We wanted to understand whether greater attention to transparency, accountability would be seen as a good thing or a bad thing, whether that would actually contribute to the creation of this culture of greater openness and trust, would reduce the levels of anxiety both among the patients and the medical professionals and the colleagues in the administration. And so what we did, of course, we also try to gear up and make sure that this initiative is as measured as possible. And I remind you that this was an initiative carried out by a public advocacy organization, yet we invited our colleagues from various walks of academic life. We had a criminologist on the team, a sociologist on the team, but people that work with social design. And what we did do is we had a representative quantitative survey, quota-based survey of the outpatient clinic patients before we started with the initiative. And after we finished with the initiative, it was a self-reported survey, yet that was what we could do at that particular point of time. We also surveyed the doctors of the outpatient clinic. At the end of the initiative, we did the exit in-depth interviews with the staff and a focus group discussion with the patients and the volunteers of the initiative. During the initiative and before we started with our intervention, we of course also conducted a number of workshops with the staff, the family doctors, the patients, to make sure that we could actually have the messages that they develop themselves and they own. Now to the messages. This is how the outpatient clinic looked like before we came in. It was a renovated, typical place that you would imagine an outpatient clinic to look like. And what we turned it into was this. We decided to name our initiative Vitamin Laboratoria, which, if translated from Lithuania, is the vitamin lab. And we introduced a feedback loop right at the entrance or the exit, if you will, of the medical establishment. The idea behind which was that when the patients would be leaving the outpatient clinic, our volunteers dressed in similar colored coats would approach them and ask them to offer feedback, their evaluation of how they felt having received a particular service in this clinic. We gave them a small white envelope with 5 yellow balls, the vitamins, so-called vitamins, and the patients were invited to drop those balls into various tubes. And those tubes really were with just different names, such as thank you. I would recommend this particular clinic. I didn't like it. Everything was clear to me, and so on. We did that for 2 months, and I will present the results shortly. We also did the other part, which we thought was very important, and that is we involved the medical practitioners, the representatives of the administration, in a value-setting exercise. Jointly, we agreed on a number of values that they thought would explain and present what it is that their service to the patients is all about. And after a number of discussions, we agreed that those values would be very simple. They would be about professionalism, and you can see that, professionalism. They would be about attentiveness, They would be about the fact that they really treat everybody. So this sense of inclusion. And of course, isoplosamus, which, if you translate it from Lithuania, is about really willing and wanting to hear the patient. We made sure that those values are not only discussed and agreed on, but also very publicly presented all across the spaces of the clinic. So we had posters like this next to the doors, posters, huge posters in the elevator. We had calendars. We had those visit slips that you would write your name and the date of the visit on, also having those values on the other side. The idea, of course, being that if it's as visible as possible, the patients would really be able to take notice of that. And again, that lasted for 2 months. Now, what did we learn? Patients really enjoyed the feedback loop exercise. They actively engaged into the evaluation of medical services. And it was not only a point of conversation, but it really made a huge difference in terms of their evaluation, both of the corruptibility and the quality of services at the outpatient clinic, which, of course, at that point of time was very new and interesting to us. So as you can see, we collected a lot of feedback from the patients. In total, more than 17,000 vitamin balls were dropped in different tubes. People actually evaluated the service in the clinic more than almost 3,500 times. And those were the numbers which were 3 times higher on a monthly basis than those that we had before the intervention. We also made sure that we collect data. As you remember, we did the representative surveys before we started with the initiative and once we finished with the initiative. And what did we learn? Well, we learned that the possibility to leave feedback really does matter. Those people who participated in the vitamin lab, as opposed to those who did not participate in the vitamin lab, clearly were in a very different state of mind when it comes to their understanding of how corrupt the outpatient clinic was. So if you were to participate in the vitamin lab, you thought that gift giving was actually much less helpful in this clinic than if you didn't participate in the vitamin lab. The same happened with money and other material gifts. If you participated in the vitamin lab, you actually thought that, well, money is less helpful in attaining good quality service than if you didn't participate in the vitamin lab. More so, if you participated in the vitamin lab or participated in the evaluation of services of the outpatient clinic, which is essentially the same, you were much more likely to recommend the clinic to any of your friends or relatives. And there we did a very simple exercise with the Net Promoter Score. The idea behind is that 9 and 10, you are a fan, you're a promoter. 7, 8, that's a neutral evaluation. Everything else is negative. Something which we thought, managerially speaking, would be a very easy thing for an outpatient clinic or anybody else interested to pick up if they were willing to continue this road. And of course, we got a little bit more data as to what was behind that positive evaluation of the outpatient clinic. Why would it be that people would recommend the outpatient clinic? And again, we saw that the perception of corruptibility of the medical establishment must have played a role, because those people who believed that money helped in getting a good quality service at the outpatient clinic were actually detractors. They negatively evaluated the clinic and would not recommend it. Minus 6.5 means precisely that. Those who believed that money would not help were much more likely to recommend the clinic and evaluated it positively. And the same went for the gift giving. We saw those who believed that gift giving helped were much more negative in terms of how they evaluated the clinic, as opposed to those who thought money did not matter. Now, of course, declared values matter too. We saw that indeed the exercise we did with the medical professionals did not go unnoticed. The first and the second wave here are the waves of evaluations that we did, basically meaning that the first wave is the measurement for the patients before the initiative, and the second wave is when the initiative already took place. As you can see, many more patients saw and noticed publicly declared values of the outpatient clinic after the initiative finished, after its 2 months implementation. More so, we think that the values were not only noticed directly, but indirectly too. And what I mean by that is that we see that patients, after the initiative took place, thought that their doctors were more polite to them and communicated with them in a much nicer way than before. We also got a very similar message from the doctors themselves during our in-depth interviews and discussions at the finalization of the initiative. We saw that they started to not only be more polite with each other, but reportedly, they started to dress nice. They started to do things together. They celebrated the fact that for the first time ever, they went on a joint trip as a community. So perhaps there's something there as well. And this is precisely what I will try to decipher and analyze during the remaining weeks here. Because of course, the goal of my project here at the Institute is to not only better understand behavioral frameworks and techniques that we employed at the Lesdina Outpatient Clinic. Remember, we did this as a public advocacy organization, many things being done intuitively. We didn't really have a proper theory of change in place. And also, hopefully, by doing that, to contribute not only to the anti-corruption research, but also similar anti-corruption initiatives aimed at changing social norms and creating this long-term sustainable behavioral change that we all are after. And I thank you very much. Looking forward to your questions.
Thank you so much, Sergejus. Wonderful. I have a couple of questions while the other people prepare their own questions. Remember, you can write in the chat. I guess my question was a little bit on a topic that most people, when they hear interventions like this on behavior, on a specific context, ask, what is your experience or what has been the challenges to replicate this kind of thing? Do you think it's easy or difficult? Does it depend a lot on or rather, what are the factors associated with being able or not to replicate it?
This is a wonderful question, Paulo, and I will try to be as brief as possible. I think the anti-corruption community as such has been quite successful in a neo-institutional sense of change. And what I mean by that is that we now have a lot of anti-corruption laws and a lot of anti-corruption institutions, but we realize that we struggle with the actual implementation of what has been written. And we see very slow behavioral change. As you saw in my presentation, yes, the numbers for bribery might be down, but those are self-reported numbers. And when people are asked about their willingness to give a bribe and asked whether a bribe would help, they would still say that yes, it could be a currency of change. And so I think the challenge with these interventions is to help the colleagues in the field, those in charge of larger institutions, such as an outpatient clinic, to take that risk and to take more responsibility and greater ownership of the issue, because we now have delegated that responsibility largely either to anti-corruption agencies or NGOs. And I think the real change is only possible when its institutions and the heads of those institutions take that on as their role. The question is, and this is why I hope that an initiative like this could be of help, how do you do it? Because a means of confrontation, when you say corruption is bad, don't do bribery, as we now know, often can be counterproductive and is conflictual in nature. This is not the way you can conduct a conversation in a very sensitive environment of a medical establishment.
Wonderful. I have two people. Sadi wrote in the chat. So there are two questions. Are the doctors who benefit of the bribe happy with the results of your intervention that lowers their income? And the second one, in hindsight, how would you improve your intervention in the clinic that you described?
Right. So this is, again, two wonderful questions. Generally, doctors were and often still are very hesitant and suspicious of interventions that are there to stir their daily routines, because of course they're very smart, well-educated individuals, but they have established patterns in which they function day in and day out. And I think it was very important for us in that particular case to have the administration on our side. I think that was the only way to have an initiative like this take place. I do think that a conversation about anti-bribery must go hand in hand with the conversation about what it is that makes you feel happy financially. How can you increase your salary in a meaningful way? However, what we have also realized since is that it's not just about money. It's about recognition. It's about status. It's about feeling good. And I think if we add those things into the equation, then it becomes a much easier conversation and change is much more possible. What it is that we could have done differently, well, that's what I will try to seek and understand while here in Paris. I think it would be nice to have run it for a longer period of time, but we had the budget just to do it for 2 months. And perhaps it would have been better if we had a more structured theory of change. But then at that point, we just were not there yet. Again, this is precisely why I'm here at the Institute.
Wonderful. Thank you. I have Lauri. Are you able to speak, Lauri?
I think so. I hope so.
Yes.
Well, my father is a medical doctor in Estonia, which is more or less one of the neighbors of Lithuania. So I think the cultures, histories might have something similar there. And I noticed that you distinguished between two concepts, bribes and gifts. And I know that in this region there is a culture of gifts. So doctors, people come to them with chocolates and alcohol. So my father doesn't drink. We have at home like a cupboard full with alcohol bottles that simply have been given by patients. And my question to you is this a bad practice? Should we unroot it, or is it actually something humane in a way that people show appreciation? Because on some level, you know, my father gained something of value, you know, some alcohol bottles, but he doesn't even use them. So the question is, should the end goal be that these kind of medical practices, for example, that they are purely transactional, people get, you know, that there is nothing of this kind in between? Is this the ideal, or we can allow something like that?
That's a very good question, and I think it goes to the core of what it is that we seek with the so-called fight against corruption, any anti-corruption work. And we have had quite a lot of discussions about this already at the Institute. I think that the conversation on bribery or anti-corruption as such is not a means to an end. It's not the end goal in itself. It's a means to an end. And what we see in various research is that those people who give bribes and engage in such a activity would actually be very happy not to do that. It's not a part of their cultural day-to-day operation. They do it because they're opportunistic. They want to speed up the process and they want to feel safer. More so, they project that experience onto other institutions and other spheres of life that they had very little experience with. So people that give bribes seem to be more likely to think that other institutions are corrupt, that politicians are corrupt. And so they're much more likely, it seems, to question the idea of the social contract they have with the state. Because at the end of the day, the anti-corruption narrative is the narrative of a middle-class taxpayer who wants to know that if they pay taxes and have this relationship with the state, they can feel safe and predictable. When they fall ill, when somebody else needs to go to the hospital from their loved ones, they can offer their children proper daycare. And if there's a public service they are in need of, they do not need to think out of their comfort zone because, as you know, the stress level does go up when people have to engage in such activities. Very few people would be, evenly paced when giving a bribe. Actually, we have a lot of anecdotal evidence that it's not people themselves, but people via third parties would be giving bribes to doctors and other practitioners because it's not a comfortable thing to do. So again, to me, that's the rationale behind it. But of course, the question is, what is the cultural connotation? In the case of Estonia and Lithuania, I think it's easier for us because we have generally agreed that we would like to be a part of the sort of Western European club and this set of values. But of course, if we got out of this region, that's a valid question.
Wonderful. Thank you. We have another question in the chat from Santiago Borda. How can the vitamin lab intervention can be replicated in smaller clinics, in small towns where the feedback anonymity is harder to achieve and reciprocal relations between doctors and patients are more likely to occur?
Yes, and this is, again, one of the questions that I'm really keen to understand better because I think the scalability of an initiative like this is key. I must say that we had a lot of interest once we publicized the results of this initiative a few years back in Lithuania. And we failed. We failed with the replication because we thought that people had to not simply take it on and do it blindly, following the steps that we had at the Lazdynai outpatient clinic, but had to add some personality and better understanding of the local immediate context to that. That was too much to ask. It was too tall of an order. And so I think that it could be very nice to have a blueprint for initiative that we would know likelihood-wise could work. We don't need to measure these things, I think, every single time, as long as we have done those measurements a couple of times in a couple of interventions. But again, I know only of this initiative and an initiative in Tanzania that follow this behavioral pattern, because generally, this is a very new way of thinking and modus operandi for a lot of people in good governance and anti-corruption, I think.
Wonderful, thank you. We have one more in the chat, and I think that will be the last for today. Mr. Sergejus, it seems you presented Soviet times. We have in Lithuania private medicine where patients go. The problem is state medical insurance and allocation of resources.
Could you repeat the question, please?
Yes, it seems you presented Soviet times. We have in Lithuania private medicine where patients go. The problem is state medical insurance and allocation of resources.
No, we presented, thank you, this is a good question. We presented the recent times. This is 2015. So that's very, very recent. And the challenge, of course, with a country like ours is that, as the colleague of ours would know if they're from Lithuania, so I'm sure they do, is that some things are also available privately, and that is the primary and secondary healthcare. However, when it comes to tertiary healthcare, and that is major surgeries, oncological treatments, that is still very much in state hands. And what we see from the data available is that these are the areas which are essentially largely affected or much more affected by corrupt practices, not only because of knowledge asymmetry, but also because of the gravity of the situation, perhaps of the gravity of the situation that people find themselves in. But I'm very happy to discuss this further, and perhaps I can use this opportunity to bring up the fact that in June, there will be such an opportunity in Vilnius, Lithuania, because we will be hosting the International Anti-Corruption Conference that our fellow Lithuanians and other people interested in this topic can register for. And I hope that will be the forum where we can address also such initiatives that we discussed today.
Wonderful. Yes, I'm sorry, that is all the time we have for this talk. We'll have the next in 5 minutes. So thank you so much, Sergejus, for joining us. Thank you everyone for your questions.